Hello everyone, I am Robert Holguin and we are winding down what's been a very busy year. But before we say goodbye to 2021, one more episode of Built in the Borderland. And you know, we haven't talked much about the pandemic as of late on this program. But today we will talk to the man in charge of the hospitals of Providence. And today we're talking specifically about a treatment for COVID-19 that's proven to be very effective.
Your body doesn't have to wait for antibodies to build. You come to the clinic and you immediately get infused with antibodies that were created for you.
Then we are talking to people who run a local plasma donation center. Now, this is plasma. This isn't a blood donation center. However, they are faced with a similar problem. They are in dire need of donors.
We were very much impacted during the pandemic when it started in March of 2019.
Then we will shift gears entirely and talk music, specifically the El Paso Opera. And we're talking today about what's in store for 2022.
We're making it non-traditional by having Frida, which is a more contemporary opera.
So let's get these conversations started on this week's episode of Built in the Borderland. So we are, of course, headed into the winter months. It's a time of year when typically people get sick. That takes on added significance when you're in the middle of a pandemic. And El Paso continues to try to manage a surge in infections and hospitalizations. A few days ago, I spoke to the man in charge of the hospitals of Providence here in El Paso, and we spoke about a treatment for COVID-19 called monoclonal antibody infusion therapy. It's proven to be very effective in COVID patients, but that doesn't mean it's a substitute for the vaccine.
My name is Tejeda, and it's my honor to serve as the Group Chief Executive Officer for the Hospitals of Providence.
Nico, thank you so much for making time. Clearly a busy time for hospitals everywhere. So I wanted to begin this conversation with a status update, I suppose, on how things are going. We know that healthcare workers are incredibly strained right now.
You're absolutely right. The healthcare workers are strained, and to be truthful, it's been that way for the last 2 years. We've seen COVID come and go, nationally and locally, but it's never gone away entirely. And unfortunately, in El Paso, over the last few months, we've seen a resurgence. Even though we've done so well with vaccinations and with boosters and with masking, we still see that a large portion of our community who are not vaccinated are still coming into the hospital and being admitted because they are very sick.
So again, you would say, without a doubt, it's the large majority of people who are still requiring hospitalization tend to be unvaccinated.
Yes, unfortunately, we still see that the vast majority, nearly 75% of the people who are admitted to the hospital are unvaccinated. Of course, there are still people who are vaccinated, but generally, if you are vaccinated, you're much less likely to get severely ill and need to be in a hospital.
Let's now drill down on what's been heralded as really, I mean, it is a remarkable treatment when it comes to COVID-19. We're talking about the monoclonal antibody infusion. First of all, explain what that is. I mean, I think it's a strange thing to say, for one thing, but what does it mean?
I think first we have to celebrate the science behind everything that is COVID therapies or vaccinations. Yeah. There are people across the world, across the nation, who are sitting here as we talk right now trying to find better ways to take care of all of us, our friends, families, and the people we love. Monoclonal antibody is no different. We know that our bodies, hopefully people know, our bodies produce antibodies. When we get sick, antibodies come in, help us fight whatever germs are around. Unfortunately, our bodies, many people's bodies, are not familiar with COVID-19. It will take time. Even with vaccination, it takes time for the body to form enough antibodies to fight COVID-19 quickly, and at least quickly enough to not get severely ill. That's where monoclonal antibody therapy comes in. Your body doesn't have to wait for antibodies to build. You come to the clinic and you immediately get infused with antibodies that were created for you. It's wonderful and it immediately helps.
But you had to have already been infected, right? I mean, so you need to be ill and then a doctor needs to say, you're a candidate for this.
So it's a couple of things. One is you have to either have had symptoms of COVID-19 and diagnosed with COVID-19, or been exposed to someone who's been diagnosed with COVID-19. But no matter what, you have to get this treatment within 10 days of the onset of symptoms. So time's of the essence on this. You have only so much time to reintroduce these antibodies into your system so they can fight it, so that the viral load of COVID-19 doesn't build and thus make you very sick.
Let's talk about its effectiveness and how some people might regard that efficacy as a reason to not get vaccinated. Is that a problem?
No, so monoclonal antibody therapy is proving to be very effective, especially for those people who get it soon as they can, which is why we're very happy that we've expanded access by expanding the number of chairs and staff available. And we're also very happy there's also another clinic on the east side of El Paso to serve our community. But because it's effective does not mean we don't get vaccinated. The antibody therapy is only beneficial for a short period of time. You infuse your body with antibodies, but soon they're gone. Your body still has to learn how to make them on their own. That's where vaccinations and boosters come in. Both go hand in hand. Ideally, you get vaccinated, you get your booster, and you never get COVID-19. But it still can happen. And if that happens, you get antibody therapy. And for those who are unvaccinated, it still can help you.
If you're unvaccinated, you get sick, you get the treatment. That doesn't mean that those antibodies live in you as long as they would if you were vaccinated.
No, that's correct. I always like to say, this is the difference of teaching a person to fish versus giving a person a fish. If you teach a man or a person to fish, they can fish for a lifetime. That's vaccination. But giving a person a fish, they eat for the day. That is what's going on with antibody therapy. It's immediate, it's today, but it won't help you 3 months from now. You'll need to be vaccinated 3 months from now. So I hope people appreciate that the scientists and all the clinicians here are trying to find comprehensive solutions to battle COVID-19. Some are short term and some are longer term. Shorter term is the antibody therapy, but longer term, we all benefit from being vaccinated.
Can you tell me mechanically how it works? Like, I mean, it's literally you sit at a chair.
Yes. So how it looks for a patient, you get diagnosed or you have symptoms of COVID-19. You have a physician who writes an order for the treatment. You come into the clinic, you sit down in a chair, and via an IV, they go straight into your body for about 30 minutes. It can be up to an hour, but 30 minutes of the infusion, and then you wait for about an hour as the team observes you to make sure nothing happens, no allergic reaction, which is very rare. And then you go on living your day. That's it. It's very simple, very straightforward. Everyone's always surprised by how easy of a process it is.
Yeah. And those antibodies that you're infused with, are they synthesized? Is that what it is?
Monoclonal antibodies, by definition, are made in the laboratory to offset what your body doesn't have. Monoclonal antibody therapy is not new to COVID-19. It's been in existence for a long time. They just have used that technology now for COVID-19. But this is not new science. These monoclonal antibodies have been used for cancer patients in the past, and now they're being used for COVID-19 patients.
Do you find it ironic, Nico, that people who are distrustful of the vaccine are fully willing to have the infusion therapy?
I think people have all kinds of reasons for being scared or not wanting to be vaccinated, and I fully understand those. One thing's certain, though, is if you talk to someone who has had COVID-19 and they were not vaccinated, they regret not being vaccinated. And if you talk to someone who's had COVID-19 and got the antibody therapy, they are grateful they got the therapy. So I really can't understand or talk about the reasons why people don't get it, but I do know for certain once they have COVID-19, vaccinations and antibody therapy make a lot of sense to them.
My last question to you here, Nico, is we're headed into the holidays. We're headed into a time of year when people get sick in general, right? I mean, it's the winter. What are your thoughts? Are you particularly worried about this winter?
I'm always thinking about the impact on our staff. Our staff have been fighting COVID-19 for a long time. Anything that we can do that reduces the burden on them, I'm a fan of. So if that means people wash their hands, if that means people wear masks, get vaccinated, antibody therapy, anything to reduce the burden on our staff to take care of COVID-19 patients makes me happy. So as I think about the holidays and I think about travel, I want people to live their life. That's why we've been fighting this fight, is so we all can live our lives still. But as you do it, I would simply want people to be responsible about it. If you have the choice to wear a mask on a plane or at the airport, wear it. If you have the choice to stand 5 or 6 feet apart, stand 6 feet. Those simple things go a long way. And most importantly, if you have the chance to get vaccinated, get boosted, do it. And if you need antibody therapy, give us a call. These things all go a long way to making sure our staff is ready to take care of anything that comes through our doors.
Coming up after the break, we head to the Lower Valley to talk about the need for plasma donors as we head into the holiday season. Stay with us. We're going to talk now about a company called GRIFOLS. It owns and operates a network of 150 plasma donation centers. That includes several here in El Paso.
Well, hi, good morning. My name is Tannia López. I'm the Regional Operations Manager here for GRIFOLS, overseeing 6 locations here in El Paso.
Tanya, first question is, what is GRIFOLS? Explain that.
Sure. So GRIFOLS is a global healthcare company. It's been around for over 100 years, and we pretty much focus on the production of life-saving medicines.
Okay. In this case, we're talking specifically about plasma, and indeed the need for plasma right now.
Yeah, so there's definitely a high need of plasma, specifically during this time. We were very much impacted during the pandemic when it started in March of 2019. Due to the low volume of collections, we have the social distancing in place, stay-at-home orders, and that really kept a lot of our donors to come to our centers to make their donations as they were usually making them. So that really impacted the volume overall here for our plasma centers.
Yeah. You know, I think a lot of us can wrap our head around what it means to donate blood, right? Like right. You hear about the call to donate blood. Explain to me the distinction between donating blood and donating plasma.
Sure. So very different. First of all, when you donate plasma, you actually get your red blood cells returned, which means in comparison to donating blood, you're donating your blood. So plasma is actually a component in the blood. It's about 90% water. It contains proteins and antibodies that help us function in our bodies. And so whenever there is a deficiency of any of those proteins, that's when people have those or can create a severely develop life-threatening illnesses. And so plasma medicines, which is what we create, what we produce, is what helps this rare and chronic diseases.
You know, you mentioned the pandemic, then we're also in the middle of the holiday season. Typically people get pretty busy, you know, this time of year with a lot that's going on. That probably also impacts the situation when it comes to donations. So give us kind of the stump speech for getting out there and donating.
So I think the most impactful thing about donating plasma is that you're saving lives. Is I couldn't say it more profoundly than we do ask that we ask for donors to come back. We ask for people to get to know what plasma donation is. Get educated with it, because you can definitely be making such a difference in people's lives when you're talking about life saving. And so we do ask for anybody out there that is interested, that wants to know more about what plasma is and how you can potentially be part of this group of people saving lives. Definitely get you to visit any of our centers here in El Paso. Like I said, we have 6 locations here locally, very convenient for anybody that wants to go in and kind of just, again, get educated and get to know what plasma donation is.
And you know, you can also get paid to donate plasma, right? I mean, that's also a big difference.
Correct. That's also the big difference between blood and plasma is that we do compensate our donors. And the main thing is because of the time spent in the center when you're making that donation.
Meaning what? It takes longer?
It takes longer. It takes between 45 minutes to an hour, depending on your hydration. So it's very important that you're well hydrated every time that you come to your donation. But that's definitely a big difference between blood and plasma as well, is that we do compensate our donors for their time making that donation in the centers.
I started back when, it's got to be the 90s maybe, because it was back when we had a plasma center on Dyer. And I did it, I guess I started like everybody else for the money. I did it, I gas money and stuff like that. But my mom was battling cancer for 11 years. She just passed away about a year ago, but even before then we knew about her cancer. And then I started researching about what plasma does for people like my mom. Now my dad has stage 4 colon cancer, and I kind of have more of an understanding, so I do it more religiously now because of the understanding and how it helps people.
So donating plasma for you goes from maybe a little gas money to something deeply personal.
So what that does is, when I understand truly how it affects people like my dad or like my mom before she passed away, it really helps as far as, to me, knowing that I can help people like my dad, people like my mom, to live longer or to be healthier. Not just live longer, but be healthier in their lives. Because you think about just going mundane through a life or being able to be active and do your life and be that. But you think of what plasma does for somebody health-wise. It gives them the chance to be happy, the chance to live a more fuller life. And I like that.
So we ask for anybody out there in our communities to answer the call, to really get to one of our plasma centers and really just, come in and really understand what plasma donation is, because you'll be doing a lot of good in this world and helping others just have a better life.
Coming up after the break, we are talking about the El Paso Opera and what's in store for 2022. Stay with us. The El Paso Opera got its start in 1992, but tonight we're talking about what's in store for 2022.
I'm currently the board president, and that's been an honor and an exciting role for me. I got involved with the El Paso Opera through my daughter, who sang for the El Paso Youth Opera. And as they started interacting more with the opera, then I kind of saw behind the scenes, and it was something that I wanted to get more involved in. And I think one of the big things or focuses of my time at the opera, or even currently where opera is today, is to let people know that opera, it's in your life, to make it more accessible and approachable and not this mysterious big theater type thing. And we've really worked hard over my 3 years as president to kind of do the rebranding and make operas in different venues that were so formal and more interactive, so that it was a little bit more approachable.
One of those successful programs really has been taking the opera literally to the people.
Yes.
Where they are.
Yes.
Expand on that program.
Yes, well, it was born out of the pandemic. And we just didn't want to not connect with our audience, and we wanted to see how could we interact with them. And so out of that 18 months, we shifted everything to virtual. So we did a lot of virtual performances, which was great because we were able to reach people locally, but then all over the country, people would tune in, that virtual programming. But the big thing, and I think the most fabulous thing that was a positive out of the pandemic, was the curbside opera. And that was really Justin Lucero's vision of bringing the opera to the people directly, like you said, outside. It was originally staged in the back of a pickup truck, And people loved it. They loved that interaction, especially at a time when there was no music and people were feeling very isolated and alone. It pulled people together. You know, they'd bring their lawn chairs out and sit and listen to this beautiful opera. And it was great for our young artists, because that was another thing. We were trying to give them an opportunity to be able to perform, because that's their livelihood. And really it was just this beautiful thing, this connection, very grassroots, and which is what opera is about too, the connection. So it was really a wonderful thing.
Now let's move to 2022. Let's talk about what that's going to bring. Obviously, Frida is part of that, but let's talk about what's gotten us to this point.
Okay, well, 2022 is, we're focusing on the post-pandemic, and we're just thrilled to be in person, live, and on a big theater, which is a little bit more traditional, but we're making it non-traditional by having Frida, which is a more contemporary opera. It's not one of your very traditional operas. Having Frida, it's a contemporary opera that really focuses on her life and how it shaped her as an artist, and then her love story with Diego Rivera. And it's a beautiful, it's different. It's in English and in Spanish. And it's this beautiful fusion of opera with Mexican folklorico music and also mariachi music, which I love and I think will truly resonate in our border region and continue to connect with our region. And I think that's what we've been trying to do with some of the programming. We did that with Cruzar, and now with Frida, we're really excited to bring something unique and relatable. But I really feel like in the El Paso Opera, we have really worked to make it, anything goes, a very comfortable environment. The Abraham Chavez is iconic and comfortable, and so we really worked to not make it, tried to make it seem less of that formal, stuffy, but it's more about the experience.
We will be right back after this break. That does it for another edition of Built in the Borderland. And indeed, that does it for another year of this program. It's been a real labor of love to bring you all this local content on TV every week. But I want to thank everyone who's been on the show. I want to thank everyone who helped out along the way. I'll be back here next year. Until then, love and light, good people. Merry Christmas and Happy New Year.